Hello, in this video I'll show you how to place a histopathology request for a patient. The starting point in this case is an inpatient ward and I've already got the patient selected. That means her details are at the top of the page and I can click to go to the electronic home page for the patient. So I click the home button to open up her electronic home page. I then go to the ICE widget, the widget that's got ICE in brackets. That is an electronic link from CareFlow to the ICE system. I want to place a request, so I tick the request button. ICE opens up, and the first thing I do before placing a histopathology request is looking at the patient's recent investigations to see if there's been a recent histopathology order made. And I can see that no, it was some months ago since she last had a histopathology examination, so I do need to place this one. I select the pathology tile and then I select the histocytology option, and because this is a histopathology test I'm requesting, I tick the histopathology box and I immediately get prompted with a series of questions. The first one is asking me if there's a danger of infection. I'm going to say no. You would of course answer appropriately. Is the patient on a cancer pathway? I'm going to say no. Number of samples, I'm going to say 1 and click the OK button. And then it's asking me about the sample type and the site. So I'm going to say it says cervical biopsy times 1. And that puts a tick in the histopathology box. I could at this point place any other requests, but in this case I just want the histopathology exam, so I'm going to continue with this request. This opens up the electronic request form and I've got to check that all the details are correct before I submit this request. So you've got my name at the top and then I've got to give my contact details in case pathology need to contact me. In this case it's my extension number. In the next field I've got to select the consultant I work under, in other words the consultant responsible for the patient. In this case it's Dr. Coley. So I select him. And where is the patient at the point of this request? Well, the patient's on the test ward, and it's also important that I ensure that the correct category of patient is selected. In this case, it's an NHS patient. On the other side of the screen are the details of the test that I'm requesting. I do not want to tick the first box, which is to fill out the details later. What that does is put this request into a suspended state for me to finish it off later. But then you've got the problem of finding it in order to finish it off later. So if you do get called away in the middle of doing a request, it's better to abort it and then do it in full when you've got more time. So I don't tick that first one. I'm going to tick print this order because I do want a printout of the order to draw a little diagram of where I'm taking the biopsy from. And I've now got to fill in the clinical details. It's suspected cancer I'm looking for, and I'm collecting the sample right now. So I put a tick in that button saying collect sample now. So I've checked that I filled in everything, and then I click the accept request button at the base of the page. After a moment, it will bring up the print dialog for me to send a copy of the form to a printer. This will allow me to draw on that form where I'm taking the biopsy and include that form with the sample that I'm taking. What I'm going to do is I'm going to save this as a PDF so that we can all have a look at what the end result of the form looks like. Okay, so I'm going to print PDF, hit the print button. The form is for patient Candy and Real, so I'm going to give her hospital number as the name of the file that I'm printing. Remember, in your situation, you'll be sending this to a printer to be printed out as a physical copy. The only reason I'm printing it out as a PDF is so that you can see what the printed form looks like. Okay, so I'm going to save that. What you would do is you'd go to the printer, you'd get the paper copy out, and you'll check that all the details are correct and that it's printed out fine. It's not smudged or faded ink. If you do have any problems with that printout, sort out the printer and then press the reprint button, because it's very important that you've got a copy of that paper order in your hand. Once you're happy with that printout, you can then press a proceed button, and that will send my request electronically to the pathology laboratory. I've got a paper copy of the form so that I can draw on any biopsy sample site body map pictures, and I will include that form and my diagram sketched on it with the sample that goes to the pathology laboratory. To have a look at your request that you've just placed, click the View Requests button, and there it is at the top of the patient's recent requests. So you've got histopathology, cancer pathway known, number of samples 1, site equals cervical biopsy. Okay, and you can interrogate it if you want to have a reminder of what you actually sent. And here it is. It even tells me what colour tube I should have put the sample in. So this shows you how you send an electronic request to the pathology laboratory, but you do print a paper copy of the form to accompany the sample on its journey to the laboratory.